Hello, everyone, and welcome to another episode of Innova Chat. Today, I have the honor and the pleasure to host Mike Easley, who is the CIO at American Senior Communities, and Andy Flatt, CIO at National Healthcare Corporation, or NHC. Both NHC and American Senior Communities are Innova Health partners, so really proud to have them both here on the show today and working with them closely on delivering rehab therapy, EMR, and practice management solutions. But today's conversation, we're really gonna talk a lot about what a CIO looks, how a CIO will look at the world in terms of technology, in terms of the post-acute care industry, and what are the challenges and what are some of the opportunities that CIOs of fairly large companies see, and what are they looking to implement in terms of technology to solve problems for their organization. So it's a very interesting perspective and very unique perspective. But before we get started, Andy and Mike, maybe you could tell us a little bit about yourself, that it's not healthcare related or not technical, just to kind of lighten things up a little bit. I'll kick it off with you, Andy.
Well, good to be with you all. I was thinking about what I do outside of work or outside technology, and it's pretty boring. Um, I would tell you the most important thing in my life certainly is family, but I have five grandchildren now, and so we're in the phase of our lives where we're helping with grandchildren, and the president of Belmont University said one time when somebody was calling him, jumping all over, he said, you can't make my day bad. He said, I'm a grandfather. So I'm sort of in that phase of my life and enjoying that.
That's a good phase. That's a good phase. Thanks for sharing that, Andy.
Yeah, and thank you again for having me as well. It's a pleasure to be here with you guys. For me, it's a little bit of traveling. So I've been doing quite a bit of traveling over the last year or so. Just recently got back from Europe, which was a blast, and then riding my motorcycles. So I have a couple, and I live close to the country
Oh,
these days. So I get out in the country and just it takes my cares away. So that's what I spend a lot of my free time doing.
very cool. I think motorcycling is great. Fortunately, my wife does not want me to partake on that until I believe our son goes to college. So I think that's the deal. So excellent, excellent. Well, again, we have two chief information officers of major corporations, probably some of the largest providers, I would say, of skilled nursing, assisted living services in the country. So, given the size of your organizations, right? And I know that NHC is a publicly traded company. I'm curious as to how the role of a CIO in senior living has changed over the past decade, right? Technology has advanced at a very, very rapid pace over the past 3 years. It seems to me that it's just accelerated, right? Not to say that the pace already was fast. Now I think it's just hyper fast. But how has your role changed over the past 10 years? Maybe we can start off with Mike.
Sure. So I would say, so I'm a working CIO, meaning I do technology and networking and other things. So I would say over the last 10 years, it's evolved from more of a technology and some information management role to more of a security and full information management, and a lot of compliance as well. So it's more paperwork these days than it is technology. Um, a lot of auditing and things of that nature. But I would say, the fun part is using information to solve problems. And so we're seeing, a real growth on that side of our industry with the advent of AI and everyone focusing more on the data. I would say over the last 10 years, we went from, baby steps into the EMR and paper-based systems and a lot of paper to full EMR and from collection of data to now utilization of data. And so that's been a real, the fun part of what we do, or at least what we do here. So I don't want to speak for anyone else, but that's kind of how it's evolved for me over this time frame. Um, Certainly, information security and the laws around that are strengthening, and we focus on that quite a bit as well. So, Andy, I don't know what you're seeing out there.
Well, I agree 100% with everything you're saying. The one thing that I'm learning, and this is my 25th year in the CIO role and title. I've only been in post-acute coming up on 9 years, but I've been in healthcare IT for 41 plus years now. And when Mike and I started, I guess it's the same for you, Mike, that the CIO title didn't even really exist
True.
back then. We're just on the edge of the data processing department from the 70s. It became MIS and other iterations in the 80s and going forward. But the biggest thing that I would say in the word is how has the role evolved? And I think the key thing, it is continually evolving. Even when I started in post-acute, and again, I've been on every side of healthcare IT. And by the way, thinking when I came to post-acute, it's just rinse and repeat. I've done healthcare. How can post-acute be any different?
Yeah.
Very, very different. But every piece of the business, from the things that we normally think about, EHRs, financial systems, down to the HVAC and dietary, run on technology.
Yeah.
So there's a lot of those things that we have to get right and make sure if they're not up and running, the business doesn't run. But I think the bigger point to me is IT is I guess still a department, but technology is a thing and is not a department. And so it's incumbent upon the CIO to continually learn and be our jobs are part CTO, part COO, part CFO. It's the business, the operations, everything that it takes to then supply the right technology. I think is where we will always, and if you're going to be in the CIO role, it's an evolving and a continual learning. Just when you think you've got something figured out, the landscape changes and you've got to adapt.
Yeah, wow. You guys both mentioned some really interesting things that just piqued my attention right away. Let's jump into security, right? I mean, I think security is such a big challenge nowadays with every pretty much department in skilled nursing, whether it's post-acute or acute, every department is really utilizing technology, right? And you mentioned security. How are you in your organizations enforcing the right policies and the right culture, the right security culture to keep the organization and the business and the patient's information, safe?
Do you want to take that one, Mike, first?
Sure. Anybody.
I was like, can Andy take that one first? No.
And let me add to that, right? Because another role that is very prominent now is the CSO, right? The Chief Security Officer, right? And do you have a Chief Security Officer in your organization, and how are you working with him or her, right, to ensure that the data is safe out of your systems?
So for us, we're a smaller organization. We have 92 SNFs and about 17 ALs, all in the state of Indiana. So I am the CIO and the Chief Security Officer combined into one. Now we do outsource some of that through our partners. So we have 24/7 network monitoring and desktop monitoring through our antivirus vendors and our network vendors. So we do outsource some of that to make our jobs easier. And then I think it's your security stack. Do we have the right security stack in place to prevent what I'll call the drive-by stuff, the real low-level things, but they catch people every day, the phishing emails, the fake websites, all of those things. Do we have a plan and a process in place for that? And then, of course, training. We spend a lot of time and effort on training our employees to look for, phishing emails. What's a real email? What's not a real email? I think, hackers and people only have to be right once to infect your system. we have to be right 100% of the time to prevent it and have plans for what happens in the case that we're not right. So to answer your question, it's a very broad-based question. I mean, we could have a whole hour on this.
Absolutely.
But in general, for us, and I think the third thing is the strategy around your software. We're cloud first solution here, so our risk is fragmented between our EHR vendors, and so an attack on one doesn't catch everything. Whereas some systems, like if you remember the Change Healthcare, they got in and they took
Right.
down their entire systems. Here, it would be an attack on one and would most likely be thwarted with from attacking other things. So that's in a nutshell how we approach it. So I could go, I could talk for an hour on this. So, but I
Sure,
won't.
I'm sure.
I'll let Andy toss in any tidbits he has.
Well, I'd sort of start where you left off. We historically at NHC, we developed all of our software. And if you're an old enough company, everybody did that. You couldn't go
Yeah.
buy things off the shelf that you can now. So we've gone from, and by the way, when we were that, we may make mistakes or we may have problems from a cyber standpoint, but we were in control of everything for the most part. Now we're a third party, best of breed, cloud first, swings it all at the other end. And for a lot of reasons and advantages, but you're also creating a lot more challenges from a cyber standpoint. We are a publicly traded company. When I began here 9 years ago, we did not have a formal title for security, but we built that since. We do have a Chief Information Security Officer or CISO. And our board and CEO have been very supportive of, again, we've been around a long time. And how do we move from here to there? We didn't necessarily know. We had to take it as we could and move into a new world. And we've had a roadmap over multi-years, but been very supported by the board, just because of the new nature of the world we live in and have risk. One of the things that's going to be interesting in the future, the CISO reports to me today.
Okay.
I think one of the things that will change is that will report to the CEO and or the board, much like a compliance officer does in public companies typically as well. So I think it's and a lot of companies in our space don't have CISOs, and we're very thin on staff too. I think our whole industry, we all run on shoestrings, but we have made that. And we'd outsourced in the beginning, and I brought somebody in to sort of help raise our CISO internally, and then turn over more and more to him. That this expert from the outside I brought in helped us make a transition for him.
That's very interesting, on how you guys are, obviously focusing, really tightly on security, but the way that you're structuring, there's some differences there. So that's very interesting.
Yeah, and I think to Andy's point, you know, and to the question you asked at the very beginning, how has this role evolved? And I would say, many of us back in the day reported up through the CFO as a real cost center to be managed, where now, we report directly to the CEOs and to the boards of our respective organizations, where the investment is understood and they're very supportive of the investment in both security, but also, with almost everything IT now, they see it as, helping the organization move forward and generate revenue, as opposed to just a static cost center that's got to be managed downward. So while we still have budgets, it's a whole different ballgame out there from when I first started.
And one other thing for publicly held companies now, the board has a fiduciary responsibility for risk of cybersecurity. It's a whole new role that I think a couple of years ago, the rule changed. So there's a lot more interest, certainly at a board level.
Yeah, absolutely.
100%. And how are you guys then working together strategically, right, with the business to help the business make better decisions, right? Because I mean, it seems to me like the role is evolving from technology to also strategy, right? To support the business with the right tools, right? And if there's no tools available, perhaps, we don't follow a particular strategy, or, we can now do this with AI. So we should follow this particular strategy. how are you guys working with your CEOs and the leadership team within your organizations to drive strategy as a CIO? Andy, I'll pass it on to you
Sure.
first.
Would we have an ever evolving, but a growing steering committee, if you will, that helps shape. Now, there's certain things infrastructurally and cyber that are behind the scenes and the business doesn't get involved in as much. And frankly, they don't care. For example, when they hit their speaker button, they expect to hear a dial tone. They don't care what it takes to make that happen on the sophisticated voice over IP telephony in the background. But
Right.
all the business facing things they do, and what we're trying to create a culture around here is it's a partnership with all of us. It's not a technology department. Again, how do we make decisions to put technologies in place that best serve the business? And I'm finding that the business, if we have that conversation and don't have that historical divide between IT and the company, we're all part of the same team. It's incumbent upon us in leadership roles in IT to personally and then to help drive within our organizations, listen, get involved. I would love, we've talked about, I would love for everyone in IT to go get their CNA license and be a CNA on weekends every once a month. Because when you're in the business and when you're entrenched in the business, then you can bring things to the table that help solve problems from a technology standpoint for the business. So that's sort of the mindset that we're all trying to work together to take.
That makes
Yeah.
sense. Right?
It's very similar for our organization. We positioned ourselves as consultants to the organization. So I have several people on my team that work on projects, work closely with the business units, get their information, get their needs, help them do needs analysis, look at various technology components. I'm fortunate. I sit on the senior leadership committee here. So I'm in at the strategic level at the highest levels, and I'm able to help drive that through the organization from an IT perspective. It's always a challenge. What we try to do is, hey, think of IT for every project. We can help you. So that's what we challenge people to do at ASC. So.
Yeah, that makes a lot of sense. And you mentioned, in that vein, right? You mentioned earlier on, Mike, you said that the part of the part of your job, you said the utilization of data is the fun part, right? So, we've seen the transition, right? Into the electronic health record, going back all the way to 2008, when we had meaningful use in acute care, right? And certainly, that has trickled down into finally, post-acute care. We now have pretty much, I would say, almost there, 100%, right? Adoption of electronic health records in post-acute care, at least in the skilled nursing and long-term care. So now that we have the data there, how are you utilizing that data, right, to improve patient care? How are you guys utilizing that data to move your businesses forward, right? So I'm curious into what what you're doing there with all the information that you have now from all the different systems that you're collecting data from. So you said that was the fun part, Mike. So I'll start with you.
So, so I was doing one of these types of interviews a while back, and someone said, what technology really makes you excited? And I was like, none of it. I hate technology. I mean, I get the newest phones, the newest computer. None of it's really all that much fun anymore. But what is fun is solving problems using data. So here we've invested heavily in a fairly robust data warehouse strategy. So we collect data. If we can collect it, we try to collect it. So we collect data from every system that we've implemented where it's feasible and makes sense. And then we combine that data into a Power BI dashboard that we push out to the various constituents in the company. So from, leadership in the field to clinical leadership at the facility level, leadership at the facility level, leadership at the dietary level. Every department gets dashboards and gets ability to see how their book of business is functioning and where there's things that they may need to focus on. And it's an evolving process. We've been doing this. I joined, gosh, it's been 9 years now. And we started the data warehouse right when I joined. and it's still a work in progress. We have robust Power BI reports, and Luis, I know we work with you to
Right.
grab tons of data and pull it into our
Mhm.
systems, and
That's right.
we developed quite a robust set of dashboards and reports and that are evolving. I even met on that this morning. So on the Innova side. So we're collecting data where it makes sense and pushing it out, and working with business leadership to define what goals they have for their information and what they need to run their book of business.
Yeah, we're very similar. I laughed when you mentioned, most places have EHRs now, and we do. We have five of them. Uh, and so just bringing clinical data together is a bunch of systems coming into the same strategy here. We have a warehouse. We bring things in. We also render and push out through Power BI. And that notion, just in general, has been a very big evolution for us because you get started, you have a few reports, and then you wake up, and it's the eternal rule for reporting. 80% of the stuff is done by using 20% of what exists, and so you have this proliferation. Now I've got so many Power BI reports, I'm not sure which one I need to go into to get what I do.
Right.
But and a couple of other things that I think are seeing that are game changers. I think in a positive way. One of the things we're doing, we have a data governance. We're having several layers of governance. That might be IT steering to select projects, a governance for data in, data out, all the interfaces that we have, but data governance. And an example of that, if you wanted a report out of your EHR that said falls, how many falls did you have? Well, how do you define that? Because there may be a place in our EHR that says here's a real fall. Everybody would agree that's a fall, but another this may I helped lower to the floor. Well, somebody on one hand might say that's a fall. Somebody might say it's not a fall. So it's incumbent upon an organization to say, first of all, let's make sure we're defining and we have a consistency across the organization of when we see a number, it's got integrity from a definition standpoint. And then I think another piece that we're just now delving into, but I think is going to serve the business better going forward, with all of these low code, no code, in our case, Power Automate, a tool. There's a lot of things that the business can do for themselves that they used to have to come to us in IT to do for them. Now, Power BI intrinsically lets you do things for yourself, but I'm even to that next level of developing, and that's a tough word depending on what you think of that. People used to call it shadow IT, and our roles as CIOs were to shut down shadow IT. I think of it exactly the opposite. There's guardrails that we all have to agree on. How to empower the business, and there's things that they may do for themselves that used to be solely an IT function.
Yeah, that's really interesting. I can go into this rabbit hole for a bit. So let's just go into the rabbit hole, right? So you mentioned data governance. Are you guys using any other tools for data governance? I know that we've made investments, for example, Innova has made a lot of investments in Snowflake, right? Is that something that you guys, I believe, Andy, you are, or Mike, or maybe both, I'm not sure, but are you using any tools for data governance?
Not specifically yet. We're crawl, walk, run right now. We're just barely starting to walk. I think we will. Intrinsically, I know Mike's shop and mine, we're in the Snowflake world because our primary sniff EHR has moved to Snowflake. So I see us heading down probably in that same direction and starting to put some tools around. But now we're just sort of drawing out the blueprints for what we want to do so that we make sure we select the right tool in data governance.
Yeah, and I would say, to Andy's point, not a specific tool, but we do work tightly with the clinical and financial teams to define what is a fall, or what's a QM, and we make sure to follow if that's a defined thing that we report to CMS. We use that data, but from a governance standpoint, not necessarily. No tools yet, but I agree. We're two of our two of our vendor partners. I like to use partners, but are in the Snowflake world, and so we're headed that way, whether we like it or not. Right? We're becoming Snowflake experts on how to get the data. So it's a short hike to get to having the data, all of our data in a system like
Yeah.
that.
Yeah. And how important is it for all your vendors, right? And you said you're dealing with 5 EHR vendors, right? I would imagine, you have your SNF EHR vendor, maybe AL EHR vendor, therapy EHR vendor, a couple of others that, I can't think of right now. But how important is it for you guys then to be able to, as you're selecting companies to work with and to partner with, right? To be able to share that data fluently with you, right? And is that a challenge, right? Because you guys are centralizing all the data, right? To be able to make clinical and business decisions, right? And how important that is, right? To be able to work with partners in where you can just get that data freely, right? From their systems. And do you find challenges there?
Mike, you want to start that one?
Sure. So it's hyper important. We lead almost with that. So when we're talking to the vendors, we let them know it's a requirement that we're going to get at our data. Now, having said that, there's various degrees of getting at our data. Some are API driven, some are, Snowflake or other types of database management systems and IT governance systems. Um, but we tell people right up front, even if we don't access the data, we determine we don't need it, we get it from elsewhere. We let every single vendor we know that we're going to want access to our data, and it's a demand. It's not a real, negotiating tactic. Um, so I think Andy, I don't know how you guys approach it, but it's non-negotiable for us that we get access to it.
Yeah, we're approaching it the same way. And what I'm finding, and I would say our biggest challenge on major systems that we've approved and done what we thought was a good job of due diligence, more times than not, where it's fallen apart is that data layer and getting access to the data in the right way. Because somebody can use the term API, but sometimes it's not really.
Right.
So I think Mike is spot on. It's all about the data first, cyber and data, and then the system and the function of the system. But so as much as we do that, the other side of it is all of our external partners, non-vendor partners, but external HIEs and those that need our data. It's the same conversation. And Mike's probably in the same conversation from a couple of places that say, just give us unfettered access to your data and we'll take what we need. We can't do that. So, we've got to not only have good free flowing data into our systems, but we've got to figure out how to make sure we're good partners to downstream partners in their needs.
Yeah. I think that's so critical, right? Like, I see kind of like the evolution of this type of systems, call them an EHR system. Now they're much more than an EHR system, right? I mean, they're full-fledged operating systems, really, that you're running, whether it's therapy or nursing or whatever. But the evolution of, going from paper into, digitizing all of those health records, right? And then being able to, in a silo, access that data, right, to make decisions, right, clinical and business decisions. But I think that now with the interconnectedness of healthcare, right, the importance of to be able to share patient health information across different areas of the continuum of care is really, really important. And that's one of the reasons why, Innova Health has invested, heavily on its data layer, right, to be able to do that, right, to be able to share, any data that you would like and be able to do that seamlessly, at a very low cost, right, to you. How are you guys sharing data with other providers across the continuum of care? Are you guys sharing data, for example, with a hospital system, right? A patient that's coming into your skilled nursing facility, post-op hip replacement, right? Are you able to access data from, let's say, Epic or Cerner, right? From your hospital partners, or are you looking into, being able to do that in the near future?
Yeah, I would tell you the answer is yes. We bidirectionally share data and have a greater need than we're able to do it currently. And when I started in my first job 41 years ago, we didn't call it interoperability then, but that's what we meant. The biggest problem we have is interoperability and standards. Well, now 41 years later, the biggest problem we have is the same thing. And so part of it's having the conversation of not just the structure by which we share data, but we're still in we're still in a paper, now hopefully electronic faxing world.
This is true.
Our admission data that comes from a hospital comes in via fax. We still have partners downstream from us that require us to put something in a fax. So I think in many ways, healthcare is its worst enemy, because we've not modernized things that some industries did 20 years ago, and that's create a standard. We say we do. You can get the flavor of the day or the flavor of the decade. You can pick whatever name you want to use, but then we turn around and say, well, my flavor of it, if I'm going to Epic or if I'm going to Cerner or if I'm going to whatever else, that's just slightly different. Well, it's not a standard anymore, and we spend all of our time. So just fax it to me.
Yeah.
Okay. Yeah. And when you're talking about, I mean, whether it's HL7, right, or Flyer standard or whatever it is, it seems that it's constantly changing. Yeah.
Yeah.
Yeah. And I would say it's even a bit more fragmented too. So we have value-based care providers and hospitals in the ACOs that are requiring us to use third-party apps to do patient matching and send certain data across to help manage that patient through the care continuum. Um, and then we get a lot of one-off logins to Epic systems or Cerner systems to pull data for some of our nurse liaisons and other things. So it's definitely a fragmented world and one that I think is ripe for consolidation. I don't know, Andy, how the HIEs is in your world. We've flirted around the HIEs up here in our side of the world, but the value proposition and the expense is hard to reconcile. So everyone's kind of going around it. There's a lot of little startups out there that have the patient matching, patient management softwares for sharing this data. But again, it's so fragmented and Andy, right, they require faxes sometimes. Our pharmacy requires faxes sometimes, and you're like, dude, it's just a mess. We need to that's ripe for innovation and cleaning up for sure.
Yeah, it's mind-boggling that the fax still a thing. I think that there's millennials who don't even know what a fax is, right? Out there. So
If they come to our industry, they'll learn.
Yeah, no, it's incredible. Yeah. Yeah. Outside of interoperability, what other challenges are you guys seeing out there? Whether it's challenges, that are patient care related or operations, business, in general, right? In the industry, what are your most pressing challenges right now as an organization, and how is technology fitting in to either solve them or at least start to shed a light on how to solve those problems? Again, very broad question. You could take it, really any way you want right now, but curious as to, we talked interoperability being a challenge, but what else is something that you're facing right now that you're trying to solve?
I'll let you go first, Mike,
Oh boy.
because I'm probably going to say the same thing you're about to say.
So broad-based for the industry, I think there's a lot of challenges. In general, revenue compression, increased labor cost, inflation. We're not in an industry where we can raise our prices to keep up with the time. So we're being asked to do more with less. And so that's the downside, right? So it's proving to be a bit more difficult. The legislative side of life seems to be getting more complex, in recent years. And it's hard to plan because you don't know which way things are going sometimes. But having said that, the cool thing about that is it gives us the opportunity to innovate. And I think, looking at how we create efficiencies, how do we help, leverage technology where we're at a kind of a crossroads where we can really leverage technology to improve life across the continuum. So from, our frontline caregivers, how do we make their jobs easier and better so we reduce burnout and turnover? I think that's a huge opportunity for us. How do we leverage information and technology to drive better patient care and decisions at the bedside so that, we're reducing any adverse effects and improving residents' health and enabling them to live their best life possible? How do we, ensure that, from a fiduciary standpoint, that we're being good stewards of the money that we've gotten, and to be able to use that to make the business, uh, put the business in a better position. I think those are all the cool challenges that come when you're in a kind of a down market, if you will. Um, and then again, I can see it, the other side of it is how do we deal with the silver tsunami that they keep promising is going to come, because it's going to fill up not only all of our skilled nursing centers, but it'll fill up home health and Medicaid waivers and things that we don't even see coming yet from a care continuum in the future. So those are the things that I see, both challenges and possibilities as well. So, Andy, I'm sure you have a much more intelligent answer than I do. So,
No, I just want to say amen to what he said. I mean,
Yeah.
on the glass half full side of the equation is you do have margin compression and payment. The reimbursement's so challenging in our part of healthcare, in a world where the regulation is higher in our part of healthcare than any other part of healthcare. And then these minimum staffing ratio type things that are just headwind after headwind. And then, and there's times when we've seen, I know over the past, particularly with COVID and other times, but all of us, we have beds that may be available, but we don't have the staffing. So we have beds sitting empty with a waiting list of people to try to get into our area. The payer side of things, Medicare Advantage just continues to squeeze and length of stays get challenged. But I think on the other side of that, if you look to the future, and Mike's exactly right, in 2030 there will be twice as number of 80-year-olds as there are today. And that's our
right.
primary sweet spot in the SNF, 82 years old probably. So the tsunamis, there's much more demand, and the workforce. And I would say if you ask our CEO, what's your top 3 challenges, he would say workforce, workforce, workforce. First of all, there's just not the birth rates are going down at the same rate. The 80-year-old existings are going up. There's just not going to be the traditional worker in many parts of our businesses before. And where I think the glass half full side of that is, if you narrow everything we do down in our worlds, we're in the business of accuracy and dignity. And the accuracy side is all the things that get done for that patient, from feeding them to taking care of their all things of the activities of daily living, make sure their clothes are clean. All the things are things that we need to do well and we need to do accurately. The administration of medicine, all of these things you can put in an accuracy side, and a lot of that accuracy side can start to be done by technology. We already have machines and vital signs machines that will do something and shoot it directly into the EHR, all kinds of innovation and opportunity there. So that dignity side of the equation, there are things in our business that can only be done and will only ever be able to be done by people. We're in and I think of our world as much as a mission as anything. We're helping take care of people that cannot take care of themselves. And oftentimes that means one of our CNA is holding somebody's hand in the middle of the night when they pass because there's not family there. You're not going to replace that with computers. The thing that I see as a challenge is if they're over here, the staff is over here trying to do all kinds of everything else that can be replaced and compromise the time for that cannot be. We've got opportunities to come in and innovate and replace a lot of manual things that are done now, or things that are done now with technology.
That's so interesting. That's a very interesting perspective. Both. Thank you. It kind of, and I think you've answered already. Because my next question really, workforce shortages and burnout are at the top of every leader that I talk to, right, in long-term care. And my question is going to be, can technology help address, this big problems? And you touched upon it, Andy, right? Like you said, well, technology can free the provider, right, to do the mundane tasks and spend more time with the patient, which is a philosophy that we hold dear, in Innova Health, right, in terms of clinical documentation is a burden, right? How can we make that easier for the clinician, for example, right, to be able to spend more time doing therapy, whether it's PT, OT, or speech therapy with that patient, right? Um, how can we free them up to do the human part? Can you give us maybe a few more examples of how perhaps technology, especially now, of course, we got to talk about AI, right? We have 11 minutes left and we haven't really talked much about AI, right? Where do you see AI playing a part in those mundane tasks in long-term care, right? To help those providers spend more time on the human aspect of things with the patients,
Yeah, I'll
or
jump in and
or
then
or or with the operational part too, right? Like we come reimbursement, right? What can we do with the providers also, with that problem?
yeah, I think there's a lot of back office function I think can really be made better with AI and really just RPA, robotic processing automation and doing things that are mundane, things that are repeated over and over again by a person that can be easily automated. I think on the clinical side, there's two therapy. We've got to stay very involved from a regulatory standpoint. The documentation burden and the paperwork burden is just continually growing. So there's opportunity to work there to simplify that. But I think one of the biggest opportunities, and AI can help with this, and we're testing this in our home care by ambient listening for taking notes. And not as much ambient as purposeful, just talk between seeing patients driving from one house to the next, and then it collects the notes, puts it in the EHR to be approved, reviewed and approved by the human. That human's still a very important piece of that. But I think, in therapy, if I have to stop and move over and start to do this when I need to be touching and feeling and helping, I think ambient listening is going to be a game changer in that world.
Interesting.
Yeah, I agree. I think that's where I think we get some really great bang for our buck is in the ambient listening and documentation improvement. So we're not stopping. I mean, now we require CNAs to walk out into a hall and punch into a kiosk 30 rooms down to document activities of daily living or to remember to do it. Where, if they can document at the bedside easily, um, it'll be a game changer. And I think it should help with caregiver burnout. I think the other thing too, and I know probably Andy's doing the same thing. Um, most of our line staff or our line caregivers, they're the most important people in the organization, yet we don't communicate well with them. They typically don't have email. We don't have a great way of texting with them. So we're investing in technologies that I'm sure Andy's looking at the same ones we are, that allow us to more effectively communicate with them and pull all of that into a single source system. So through our payroll vendor and through others to really be able to effectively communicate with that frontline staff. So I think that will help as well. So I don't want to just focus on the improvements in the care side because we have the back office and we touch them with so many different levels, but how do we make them feel a real part of the organization when they're wholly disconnected other than verbal, today. So
Yeah. Front staff, you mean front staff line, front staff, you mean
like
from
CNAs,
CNAs to
nurses,
nurses, therapists.
to therapists, to
Yeah.
dietary or culinary. Well, I'm going to get in
All
trouble.
right.
Culinary, not dietary. I have to
Okay.
put $1 in the culinary jar now.
Yeah.
And then, and housekeeping, laundry. Folks that
Yeah.
do, such a
Mhm.
such a great job, yet we don't effectively communicate with them. I mean,
Yeah.
we paste something to the time clock and hope they see it,
Mhm.
so there's a better way out there, and we're
Yeah.
working on that.
Yeah.
And I think to that, what we're finding, if we can keep somebody 90 days, we've got a lot more chance to still have them at the end of the year. And we're so understaffed in a center and ready to get somebody out on the floor. but we've got to take the right amount of time to train somebody and to equip them. But really, on all the onboarding things, just from simple, all the stuff you do from an HR standpoint to become an employee, we've got to make sure we're simplifying that and making it easy on the future employer or the employee that's often been too burdensome.
Yeah. And I know that this is a question I think going back to, I told you I was going to jump around, right? So I'm going to go back a little bit, right? Because I'm interested. You mentioned, that, you have a lot of data, right? From, separate systems, you're aggregating all this data, but you rely a lot on vendors, right? To get the right tools in place, right? Whether it's, yeah, I'm talking primarily software, right? Do you see now a world in where, with agentic AI primarily, right? Agentic AI and uh, AI in general, and where you can use that data, you can leverage that data with, let's say, simple coding tools, whether it's low code tools or maybe bad coding tools, right? And use agents to start creating your own tools, right? Is that something that you guys are looking into, or is that something more of like more futuristic for you guys? Or are you still planning to continue to rely on vendors for that, right? And I'm talking about like solving workflows that we were just talking about, right? Like, how do we solve a labor shortage problem? We gotta help the providers do more with less. Then we, deploy agents to do that, right? With all the rich data that you collecting. Does that make sense?
Yeah, I'll let Andy go first.
It does make a lot of sense. I would tell you some of the things we're doing now is, and we will always try to have the right balance of internal versus external partnerships. But in some of the RPA things that we're doing now that will lead to agentic and start to make decisions for us, we're partnering with outside firms to help us create those systems that we own. It's our IP, but teach us to fish as well, rather than just giving us a fish. So we'll outsource more in the beginning and hopefully insource it over time so that we can maybe be more cost effective in doing certain things for ourselves, but certainly turn it around quicker.
Interesting.
Yeah, and I think we have the similar, strategy is, rely on our vendors a lot more early on. But also we're leveraging things like Power Automate, RPA to try to minimize, touch on many of our operations right now. So I just think we'll continue down that path, in my mind. So
Yeah, interesting. I just kind of, this is just a random question, but I was just curious. We'll see what was your perspective on that. We have just a couple minutes left. Curious as to, both of you guys have been early adopters with Innova Health, um, early partners, right? Going back to last year, made a bet, right, on a startup, really, and wanted to get your perspective in terms of, how has Innova helped you deliver, right, more cost efficient, better care for patients in your organization.
So I can go first. I think, for us, and we did some time studies early on. We were an early pilot with you guys, with Innova, and we were saving uh, a fair amount of time per patient interaction. So we were able to leverage that and the ROI from that into making a decision to go fully with Innova across our entire continuum. And we continue to see that the frontline staff, our caregivers, the people touching our residents, um, really enjoy the product. They find it easier to use, quicker to document, um, you know, and so for us, given the state of the marketplace, you guys have come into a good market to innovate in, and it needed some updating, if you will. I think it made an easy decision for us to go full house. Um, and just like anything, there's been a challenge here, a challenge there, but we've been able to overcome it. And I think you asked a question earlier about partners, or we touched on partners. You
Yeah.
guys have been a great partner. I mean, we've been able to work with you directly to focus on reporting or other types of things that we need, and it's been very easy to work with. So for us, that's in a nutshell, why we decided to go with you and why we're happy that we went down that path.
Yeah, I agree with Mike. As I thought about this question, and I was an entrepreneur, started in 1989. We created an EHR. You didn't call them that even then. And one of the things that I've learned, and some advice that I would give startups, it's easy to do a lot of good things quickly and get out of the door. And the reasons that and first of all, let me back up and say the success we've had with Innova from our standpoint, or from my seat specifically, has mainly been the leader in our therapy business. She and I are harnessed and partnered together, and I know she's been very partnered with you all, giving feedback, and that's been very important. I think the challenge is, and it's with any you hit these milestones as a startup, and you start to get some traction, you start to be big enough. Then you've got to make sure you invest in, do we have good QA environments? Do we have good testing environments? Because what often happens is, in the pursuit to get a lot more functionality out there really quickly, you do that, then you break something that was working yesterday in order to give you something that you wanted tomorrow. And then you settle down and you get these good multiple environments and a good QA environment. I would tell any startup to think about that early and first, because you'll be 100 miles an hour and got a lot of good traction, and you'll come to a screeching halt because something breaks. And if the wrong thing breaks in healthcare, particularly on the clinical side of healthcare, you're not just potentially messing a business up financially. It's patient care you could potentially hurt.
Yeah.
So very
Yeah.
important for startups. And now with AI, there's startups everywhere. Everybody promising we're an expert in AI. If they say that, that's sort of
That's
a
right.
showstopper. Nobody is yet.
That's
But I
right.
think that's, and again, we got a partnership. Things are going to happen. We got to understand going in that things are going to go wrong, but we want to work with you all to minimize those, to be able to fix them as soon as possible, and then be able to mature and expand from there.
Right. Yeah, yeah. Thank you, Andy and Mike, for that feedback. I'll leave you with this last question, and it's more of I think, optimistic question, but what excites you the most about the future of senior care and your organization? I know you guys operate in on multiple levels, whether it's skilled nursing, assisted living, home health care, right? So you guys are touching different areas of post-acute care and senior care. What truly excites you right now?
I would tell you what excites me is just from a technology standpoint, the opportunity that innovation and technology has to be a game changer. What scares me, we want to do more and more at home. I want to be home longer and longer if I need services in the end. That just means the acuity when they do come to a sniff is going to be more severe. And what excites me is we've got to get together. What scares me excites me. It's the need that excites me to say we've got a problem that we've got to solve, and let's get about solving it.
Yeah, and
Mike?
I would say the same. I said it earlier, what excites me is using data and innovation to solve problems. The technology in and of itself isn't all that exciting. But I do think, we're going to see things from a hardware and software technology perspective that will become more exciting because we are going to be staying in place longer. We're incented to do that. And Andy's right. We're going to have a higher level of acuity in the nursing home, in the assisted living, and in the home care markets, which we don't see today. So being able to drive that information and data to the caregiver at the right place at the right time, so it's actionable, is going to be key, and through the healthcare continuum. So these partnerships you mentioned earlier with Epic and others, it's going to be key to have that data at the bedside, at the chair side, in the home, wherever we meet that patient or that resident at, to be able to effectuate great care for them and to allow them to age in place longer and to live their best life wherever they are, whatever part of the continuum they're in.
So that's a great place to end this conversation, gents. thank you so much for your expertise and knowledge that you shared today. If you're interested in hearing more about industry leadership type of conversations like this, you can go to our YouTube channel, just search for Innova Health. You can also find us on innovahealth.com online, and we'll be posting this on our YouTube channel as well as many other conversations. We don't yet have something lined up for the next Innova Chat, but stay tuned and we'll be announcing that on LinkedIn. But thank you again, gents, and I'll stop the recording now. Thank you.
All right, thank
Been a
you.
pleasure.
Mm.